We started with hope. The COVID-19 vaccination rollout had begun, and we'd set up mass vaccination centres in Truro, Stithians and Weybridge. Since the first vaccinations in December 2020 and continuing throughout the past year, more than 858,000 vaccinations have been given to over 370,000 people in a variety of settings, from their own home to care homes to the mass vaccination centres. Over 6,700 volunteers and staff from RCHT and NHS partners across the county gave their time and expertise to protect the people we serve. It was truly inspirational and represented a coming together with energy and resolve to start to turn the tide of COVID-19. We are so proud of our research teams for their contribution to the pioneering efforts of scientific teams across the country to find and test new vaccines and treatments to tackle the pandemic, and which have been influential in the fight against the virus. The impact on our staff has been significant, as we've tried to manage the best we can amid unprecedented pressures and a sustained period at critical incident operational level, whilst caring for people who need our help and remaining absolutely clear in our priority to keep patients and staff safe. We put in place a variety of ways to support our people, from a 7-day-a-week helpline to cold water swimming therapy, and our RCHT charity and friends at the hospitals have played their part too. We know that supporting our workforce and providing colleagues opportunities to recharge, develop and try new things is a fundamental of our focus for the year ahead. Our annual Brilliant Youth Virtual Festival and Thank You Week saw 40 teams and individuals presented with awards, and more than 390 received nomination certificates. Our people have also been recognised at regional and national level with Health Service Journal, NHS Digital Cyber Associates Network, Paediatric Awards for Training Achievement and Cornwall Apprenticeships, among the long list of awards celebrated over the last year. Yet, amid these unyielding pressures, we have continued in our ambition to provide brilliant facilities in which to provide brilliant care. This was exemplified by the completion of Wheel Vor ward in the Tremeno unit, completed on budget and to a testing schedule to help us respond to the additional demands of winter. Not only offering excellent facilities, the ward team delivered an innovative model of care, combining re-ablement for frail and elderly patients, as well as a training base for new recruits into care. Originally a short-term project, its success has seen the Wheel Vor team move to St Austell Community Hospital, where the model of care is being developed for further expansion to other community hospital sites. The Tremeno unit is now being refitted for its next role, where it will house our inpatient oncology ward, Lowen, until the new MRI and oncology unit opens in 2023. This is one of the key moves as we prepare to release the space for the eagerly awaited Women's and Children's Hospital. Alongside physical developments has been the introduction of new digital technology in every aspect of our lives within RCHT, with the pandemic leading us to bring forward advances more quickly than we might otherwise have done. For our patients, the most visible of these has been telephone and video appointments, alongside automated text appointment reminders and virtual waiting rooms, and most recently, the Patient Hub online platform, where people can see and manage their own appointments. Whilst maintaining letters and face-to-face options for people without access to digital platforms, these changes have been welcomed by patients of all ages, reducing the need to travel, as well as resulting in far fewer people not attending their appointment. As we look to the future, these digital advances are also a key part of our commitment to reducing our carbon footprint as a joint signatory to the Cornwall Public Service Climate Emergency Declaration. We have been leading the way in the use of reusable PPE including face coverings for non-clinical areas, and, more recently, the trial of reusable face masks for clinical areas. Taking this a step further, we are now piloting the use of fully reusable PPE, including theatre gowns, in our theatres. We've also been looking at how we can introduce changes to treatments, medications, and the way we deliver care to reduce their impact on our environment, such as educating people on the effective use of inhalers and moving to powder-based options wherever appropriate. As we know, our biggest challenge is making sure our communities can access the right care in the right place when they need it. None of us want to see patients waiting for ambulances, waiting to be admitted to hospital, waiting for planned operations, nor waiting to leave hospital when they're ready to go home. Our need to work with partners across health, care, and the voluntary sector has never been greater, as only together can we tackle the difficulties we face, not least those posed by a highly competitive recruitment market compounded by shortages of affordable housing. We will need to take innovative approaches to our future workforce, offering flexible employment and rewarding career pathways, making it possible for people to stay in our county, to develop the talent we have, and to attract others to come here too. Our ambition to become a teaching hospitals trust will play an important part in building our national and international reputation as a place to learn and grow. Wherever possible, we want people to be able to access their acute care in Cornwall, rather than having to travel to Devon or elsewhere. We also want to ensure that where appropriate, people can receive care closer to their home, rather than on the acute site. We know that to sustain improvements in health and care, we need to work collaboratively with our health and care partners. We want to strengthen clinical partnerships, both locally with integrated care areas, primary care networks, and the Cornwall and Isles of Scilly integrated care system, as well as regionally with acute providers in Devon and Bristol. We must also continue to seize the advantages digital advances will bring to improve patient care and safety, as well as the efficiency and effectiveness of our services. What might have been regarded as science fiction a few decades ago is fast becoming a part of everyday life, with our clinical specialists increasingly using artificial intelligence and virtual reality technologies in diagnosis and treatment. It presents new opportunities for our patients to have greater control of their care records through the advent of shared online systems between health and care providers, electronic health records, and appointment systems. We by no means underestimate how much we have to do as we recover from the pandemic and tackle the very real challenges that remain for our health and care system in Cornwall, and not least to ensure our patients receive the safe and timely care they rightly deserve. To our people across Royal Cornwall Hospital, St Michael's Hospital, and West Cornwall Hospital, we say thank you for your care of our patients and for your care of each other. We are here to care for you.